Elephantiasis, also known as lymphatic filariasis, is a chronic parasitic disease which causes extreme swelling of major parts of the body, most commonly the legs, genitals, and breasts. The term elephantiasis originated from the resemblance of the affected skin to that of an elephant, which is coarse, thickened, and deeply folded. About 120 million people across the globe suffer from lymphatic filariasis or elephantiasis. This condition is mostly common in tropical climates, especially countries in Asia, Africa, and South America. To understand how a person develops elephantiasis, it is important to follow the process from the moment of infection to the physiological changes which lead to the dramatic swelling associated with the disease. The transmission cycle of elephantiasis begins when certain mosquito species, such as Anopheles, Culex, or Aedes, takes a blood meal from an infected human host. After ingestion, the mosquito now becomes a carrier of microscopic larval forms of parasitic worms, primarily Wuchereria bancrofti, Brucia malayi, or Brucia thymori. These parasitic larvae, scientifically known as microfilariae, are produced by adult worms that reside in the lymphatic system of an infected human. When the infected mosquito takes a blood meal from another human, it deposits tiny larvae onto the skin. The larvae actively penetrate the skin through the puncture wound created by the mosquito's feeding apparatus. This marks the beginning of the infection in a new human host. At the early stage, the infection is entirely silent. The individual feels nothing beyond the typical irritation of a mosquito bite. Yet beneath the surface, the larvae begin a slow migration through the body. The larvae finally locate the lymphatic system. The lymphatic system is a crucial part of the immune and circulatory systems. It consists of a network of lymph vessels, lymph nodes, and lymphatic organs which function like a drainage network, collecting excess fluid, proteins, and waste products from tissues and returning them to the bloodstream before filtration of the blood by the kidney. Within the lymphatic vessels, the larvae mature into adult worms over a period of several months. Adult worms can grow to several centimeters in length and can live within the host for many years, even up to 10 years. When adult worms lodge themselves in the lymphatic vessels, they begin to disrupt the flow of lymphatic fluid, gradually causing inflammation. The presence of dead worms makes the situation worse, as their breakdown products trigger additional immune reactions. Gradually, the lymphatic system loses its ability to efficiently drain fluid from affected tissues. At this stage, lymph fluid accumulates in tissues, particularly the limbs, breasts, or genitalia, leading to extreme swelling known as lymphedema. Swelling becomes permanent and may progressively worsen. The skin thickens, hardens, and becomes folded, while connective tissue proliferates in response to chronic inflammation. Elephantiasis represents the most advanced and severe stage of this process. The affected body parts, most commonly the legs, can enlarge dramatically, sometimes reaching several times its normal size. Elephantiasis can also occur without parasitic infection. These cases are referred to as non-filarial elephantiasis. Common causes include chronic bacterial infection, genetic disorders affecting lymphatic development, cancer or tumors obstructing lymph vessels, surgical removal of lymph nodes, and severe trauma or injury. While elephantiasis is difficult to reverse in advanced stages, treatment focuses on stopping progression and improving quality of life. Antiparasitic medications are used primarily in early stages. These drugs kill larvae and reduce transmission, but may not eliminate adult worms completely. Compression therapy may also be initiated. These are bandages or garments to reduce swelling. Efforts to eliminate lymphatic filariasis have significantly reduced cases in many regions, but millions still remain at risk.